and opportunity framing. So now I request you all to please turn on your cameras so we can quickly take a screenshot of all the present ones. So, ma'am, so I request you all.
Participants, please turn on your cameras for few seconds only.
So now, without further ado, let's start with our first session, which is based on the topic empathy and user-centered research in healthcare, which is going to be given by Mr. Mudit Khetan. So, Mr. Mudit is a principal consultant at Data Couch. He is a learner, change leader, project manager, communicator, content strategist, value investor, Reiki healer, and rationalist. Some of the top skills of him includes project management, sequence query language, change management, content strategy, and business analysis. Today, he is here with us for a session which is totally based on empathy and user centered research in healthcare. So, let's welcome Mr. Mudit to start the session. So, sir, please start the session. Now it's all over to you.
Thank you, Abhida, for welcoming me with these kind words. And thank you, Dr. Reema Mera and GIT family for giving me this opportunity. I hope I'm clearly audible and my screen is visible to all of you.
Yes, sir. Please continue.
Correct. So, good evening. As Abhida gave my introduction, I'm Mudit Khetan, and it is not sequence query language, it is structured query language. So, there are multiple things that we work at data couching. And some of those things include artificial intelligence, user experience design, data analytics, generative AI, and so on, which I'm also very much interested in and contributing towards creating high impact content and high impact trainings for our clients. So just to give you a very brief introduction about myself, I have over 20 years of experience as an educator, as a corporate instructor and a consultant. And I've had the privilege of collaborating with industry leaders to implement AI-driven solutions that enhance patient care and streamline healthcare processes as part of my role as principal consultant with Data Couch. Uh, First of all, to bring everyone on the same page, I'm not in any sense remotely related to the healthcare field, but I'm approaching this issue from a user-centric perspective, from a perspective of a consultant who has worked with healthcare providers to deliver these kind of solutions. So in a rapidly evolving healthcare landscape, empathy is paramount, and we understand the value of empathy not only in our personal lives, but also in our professional workforce. By deeply understanding patient experiences and needs, we can design user-centered solutions that not only address clinical challenges, but also resonate with patients on a personal level. This empathetic approach ensures that our innovations are both effective and meaningful, ultimately leading to improved health outcomes and patient satisfaction. So today in this session, we are going to explore how integrating empathy into our research and design processes can drive impactful healthcare innovations for our patients as well as healthcare professionals or HCPs. So we have already covered this thing, so I'm just going to skip my introduction part. Uh, I'm just going to give a very brief introduction about the company that I represent. So about Data Couch, we are into major services such as consulting and solution implementation, which are tailor-made solutions. We are into transforming professionals with high impact training solutions, which are customized for organizational needs. We also have a proprietary browser-based virtual lab solution that delivers isolated environments for training as well as product demonstration and other aspects of virtual labs. And we also offer managed services. So our footprint is in many countries and across all the major continents. We have so far transformed the lives of 200,000 participants overall in 100 plus different technologies. The current focus of the company in this new wave of artificial intelligence, data, and Web3 is obviously on these technologies, which involve Web3, generative AI, big data, DevOps, cloud, and many more. We have a network of industry experts which are globally renowned and certified by Google and other companies that are part of our network of consultants and instructors. Some of the clients and partners with which our company works is, this is only a partial list of all these companies that we have worked with. These are some of the meetup groups where we wish to share our knowledge with community. We regularly host different meetup groups. You can scan these QR codes available on your website, or you can go to meetup.com and you can look for these particular meetup communities and become a member of these communities to participate in different sessions. As a recognition of our dedication to client as well as to our participants, we have been continuously awarded as the global education. We are the only company to be awarded the global educational partner of the year by one of the very, very important technology giants, Confluent, which is into real-time data streaming and data analytics and AI-related services. We are also proud to be the first training delivery partners for Starburst, One House, and Current, which was formerly known as Event Store. Now, before I move ahead, let me just set the context. So empathy is the cornerstone of effective healthcare. It involves understanding and sharing the feelings of our patients if we are healthcare professionals. So for example, if I'm developing a solution for a hospital in which any of the healthcare professionals, whether it is the hospital managers, the doctors or surgeons, the nursing staff, or even the patient or their caregivers are going to access that application. So I'm also a healthcare professional indirectly or by a second degree of relationship. So by having this empathy, it allows us to connect on a deeper level. And this connection not only enhances patient satisfaction, but also leads to better health outcomes. To illustrate the profound impact of empathy in healthcare, let's watch a very brief video titled Empathy, the Human Connection to Patient Care, which was produced by Cleveland Clinic. I'm going to just play the video. Please let me know if you are able to hear the audio. I'm sorry, just a minute. Is the audio audible to all of you? Give me a thumbs up.
Yes, sir.
Thank you. So this video very powerfully demonstrates that every patient has a unique story, and by embracing empathy, we can provide care that truly addresses their individual needs. Understanding our patients' perspectives enables us to build trust, improve adherence to treatment plans, as well as to ultimately achieve the goal of effective care. So we must all have this question, and that question is, what exactly is meant by empathy? So anyone would like to unmute or type their responses in chat? Please, you're welcome. Anyone?
I
Yes, sir.
Mr.
Mr. Mukherjee, you want to share something? All right. So Mr. K. Ravi Kumar shares that we need to feel the pain. That's great. Thank you, sir. Anyone else? Mr. Anirudh Gangadharan shares that taking the perspective of the other person. Exactly. All right. Thank you. So let us just understand what is empathy and how does it impact healthcare innovation and how it is going to change the way we look at anything, whether it is healthcare or anything else, right? So empathy can be defined as our ability to understand and share the feelings of another person. In healthcare, this means truly grasping what not only our patients are experiencing emotionally, mentally, and physically, but also what the caregivers, be it the doctors, nurses, support staff, and most of all the families are going through, because that is also very important, as we saw in this particular video. This will help us design the systems that are built with their needs in the mind and not our technical capabilities. So this is when we reach to a particular client, especially if they are from the healthcare sector, we have to keep this thing in our minds, right? The benefits of practicing empathy in healthcare are very well documented. So first of all, you have the improved patient satisfaction and patient experience. Patients who feel understood are more likely to be satisfied with their care, and they are more likely to be sharing the exact understanding of their own feelings and their symptoms with the healthcare providers. It results in enhanced doctor-patient communication, which can result in better health outcomes. Empathy can lead to greater satisfaction, trust, and better adherence to the treatment by the patient and their caregivers at home or at the hospital setting. And obviously, it is going to help us in improved emotional as well as mental health. Finally, it is going to drive medical innovation. By integrating empathy into our daily practice, we not only enhance the patient experience, but also contribute to more effective and compassionate healthcare delivery. So these have been well documented in research. I have the links for all these research within the presentation, and I would be very happy to share with them all these references with all of you at the end of this presentation. Uh, Sorry, I missed the comment from Mr. Chandra. Be with them. That's very, very important. Thank you, sir. Now, before we go on to study about how we can implement empathy in our healthcare practices, let us delve into a few case studies and first of all understand where it all originated. Before we move ahead, I'd like you to reflect on, for a moment on a few questions, and I want you to unmute yourself or to type your responses in chat, whatever suits you better. Have you ever felt uncomfortable in a hospital setting? It can be anything. It could have been, God forbid, your own medical treatment, or it could have been somebody near and dear, or you must be visiting somebody and you saw some other patient going through some terrible situation. So have you ever felt uncomfortable in a hospital setting? You can simply type a yes in the chat. That would be sufficient for this thing. Right. Thank you. All right. Let me ask you a follow-up question on them. What aspects of this hospital environment contributed to that feeling? And what changes might have improved your experience? If anyone can unmute and briefly share what particular thing caused that particular unsettling feeling and how you could have changed it or what you would have expected to change. Anyone? Sorry. I'll repeat my question. What aspects of the environment contributed to that unsettling feeling, uncomfortable feeling, and what changes might have improved your experience? Anyone?
Sir, am I?
Yes, please go ahead. Dr. Sabita, please go ahead.
Sir, waiting for the doctor, that is painful for the patient.
Right.
And discrimination with the different patients, discrimination with the patients.
Mhm.
If we are having the approach, then definitely doctor will give the attention. Otherwise, they will not just taking the pain.
I understand your point. As far as the second point is concerned, I actually have only one thing to share, that even if the doctors would have this kind of empathy, or the administrators who are actually managing the entire healthcare community and the doctors and everything, if they have this empathetic approach, I guess the second pain point would can be alleviated very, very easily. But when it comes to the first pain point, that is something that we can take care of in our designs, in our system designs. So thank you for sharing this, Dr.
Yes,
Smita.
sir. Thank you, sir.
कायरा
Yes.
कायरा
Uh,
1 मिनट अंदर आओ.
Ritika, ma'am, would you like to share something? All right. Anyone else? All right. So let's explore how Mayo Clinic has addressed such challenges. In early 2000s, a physician at Mayo Clinic, Dr. Nicholas Larusso, began asking himself a question: can we also test new kinds of doctor-patient interactions? That was the basic question. All right. So Mr. Chandra SR says, infrastructure issues in a room given to patient, most of the time we feel we are unnecessary waiting for long. Certainly. Thank you, Mr. Chandra, for sharing this. So this physician, Dr. Nicholas Larusso, actually asked this question, that can we also test new kinds of doctor-patient interactions? And that gave rise to this whole new idea of empathy within the healthcare systems. So in 2002, as a result, they collaborated with an organization, a design firm, IDEO, to establish the Spark Lab. And this space allowed physicians and designers to experiment with new models of patient-provider interactions, aiming to create a more empathetic and patient-centered healthcare experience. Now, the implementations included various aspects of patient experience that were redesigned within this Spark Lab setting. So first of all, waiting areas were reimagined to be more comforting and less clinical. I guess that could have addressed some of the pain points that Dr. Sarita and Mr. Chandra has raised. Clearly signage to reduce patient anxiety, and processes to prioritize patient narratives in care delivery. So, for example, if the doctor or anybody is not understanding, or they have limited time, but still they were trained to actually prioritize the patient narratives in the care delivery. And these changes were rooted in deep understanding of patient needs and perspectives. The impact of this particular study and this initiative of these interventions were very, very profound. While specific quantitative outcomes from this initiative are not extensively documented by Mayo Clinic, the qualitative feedback that was received have been overwhelmingly positive. So patients reported feeling more valued, understood, leading to enhanced satisfaction with their care. This also underscores the importance of integrating empathy into the healthcare design, not only just as a concept, but also a tangible practice that can transform patient experiences. What it means for all of us is that by prioritizing empathy and patient-centered design, healthcare providers or HCPs can actually create environments that not only heal, but also comfort and inspire the patients and their family. The Mayo Clinic's approach serves as an example of how thoughtful design can lead to meaningful improvements in this patient care. Now, there are multiple user research techniques in healthcare that we can undertake within this domain for identifying the patient pain points or other aspects. So, understanding the needs and experiences of patients is crucial for developing effective healthcare solutions. So, there are certain key research techniques that can provide valuable insights to the researchers in this area. The first one is interviews. So conducting one-on-one interviews with patients, their caregivers, their family, the healthcare professionals allows us to gather in-depth information about their experiences, needs, and challenges. One example could be that a researcher interviews diabetic patients to understand their daily routines, dietary challenges, and medication adherences. So, for example, the Indian diet, the typical Indian diet, which is full of fat, which is full of sugar, which is full of other things, and which has also been kind of sprinkled with junk food nowadays, uh, becomes a challenge to maintain this kind of discipline at home. So, if a researcher or if a healthcare provider is able to understand those challenges, they can actually suggest ways to improve their dietary intake within the given constraints, whether it is financial constraint to go for a what you say micro and macronutrient rich diets, which is free of fat and sugar, right? So this insight can inform the design of personalized management plans for diabetic patients. Another key research tool is observation, that without intervening into the overall situation, a researcher can observe patients and healthcare providers in real world settings to help identify unarticulated needs and workflow inefficiencies. So, for example, the waiting area thing that few of the participants earlier mentioned, that can be observed not only with the help of interview, but that can also be observed. We can identify how long it takes for a patient to keep waiting in the waiting area and so on. So one of the examples of implementing this can be that by shadowing nurses during their shifts, designers can identify bottlenecks in the electronic health record systems. So most of the health record systems nowadays, even in government hospitals, not only abroad, but also in India, are becoming electronically available so that the doctors have better visibility about the diagnostics and reports and other vitals of their patients. So bottlenecks in the EHR or the electronic health record systems is something which can lead to more intuitive interfaces and designs that is more suitable for nurses and doctors to handle and work with. The third research tool that we can use is journey mapping. So by creating journey maps, we can visualize the patient's experience through various stages of care, highlighting the pain points and opportunities for improvement. For example, we can map the journey of a cancer patient from diagnosis to treatment to reveal that emotional highs and lows are part and parcel of the journey. This can also enable the development of support resources at critical moments in the time. For example, creating support groups or providing some sort of counselor or psychological help or emotional support groups, or addressing this issue with the help of the family members of the patient. So by employing these user research techniques, we can design healthcare solutions that are truly patient-centered, addressing the real needs and improving the overall care experience for everyone which is involved, who is involved. One of the examples of this particular is the GE MRI machine experience, which is enriched by design thinking. So I hope that I really hope that none of you has ever experienced the MRI machine, but you all know about how an MRI machine looks like. So you can see that there is a machine in this image, and this is a very large round machine with a very hollow tunnel in it. And because it is a very powerful magnet, there is a very large, very loud sound or noise that actually disturbs the patients, right? So GE Healthcare recognized that children often feel anxious during MRI and CT scans due to the intimidating environment of these machines and the lab. Now, I can personally relate to the anxiety that MRI procedures can induce. So when I was going through post-COVID symptoms, including fluctuating blood pressure, this is my personal experience. I underwent an MRI scan, and during my first attempt, the combination of the tight enclosed space and the loud noises from the machine was overwhelming. I was supposed to be in the machine for at least for 10 to 15 minutes, completely stationary without moving any muscle in my body. But I could not endure the procedure for more than 15 seconds. So not 15 minutes, only 15 seconds. So the doctor administered some sort of tranquilizer, and he suggested that I take back the procedure after an hour once the tranquilizer sets in. But I found myself unable to continue beyond 20 seconds before having to stop. So the MRI was never done. Fortunately, there was no serious issue which required any kind of MRI. That is why I'm here presenting all hail and hearty. But that is not the case with children. So to address this very problem, GE redesigned the scanning rooms into adventure-themed spaces such as pirate ships or space adventures. And this empathetic approach transformed a frightening experience into an engaging one for children, significantly reducing the need for sedation and improving patient cooperation. So let me just quickly play a video for you.
Hi, I'm Doug Dietz. I'm the principal designer for global design at GE Healthcare, and I'm the lead designer for Adventure Series. The Adventure Series is really an activity that we've been working on to see what can we do around our diagnostic imaging equipment to make it friendlier for both the family and for young patients. We have large diagnostic imaging equipment at GE Healthcare. They're huge, and some of them make noises. Adventure Series is really looking at it really from the child's perspective, looking at where their anxiety points are and coming up with some really nice solutions that help those, whether those are visually taking over the room in a theme, like a jungle theme or a pirate adventure or something, as well as music that leads them into the room and coloring books. So we wanted to have elements that addressed all the anxiety points.
My name's Liz Auer.
I'm Duncan Auer.
Where is this?
Children's Hospital of Pittsburgh.
Well, we're here today for a CT scan of Duncan's sinuses. He's had some really chronic congestion and coughing. So we're going to have a look and see what's going on in there. And the pirate room was pretty cool. Mm-hmm. The room was painted completely like a pirate setup, including the floor. The floor was like the dock with the water on the sides, and animals and things on the walls. And the CT scanner itself was like the wheel of a pirate ship. It's for a child, it can be kind of scary. You see things that make noise and it look very institutional, and this is, you're not even really thinking about the fact that you're doing a procedure. Very, very welcoming, very whimsical and fun.
Distraction starts out with a few items to try to catch the child's attention. But you need more than that. You have to have the buy-in from the staff, the physicians, from the nurses, the technologists, and even the families, so that when they come here and they see what we've done and how we've decorated the rooms, they feel as if they really are on an adventure. And they feel when they're having their scan, there's no need to be panicked or afraid. So that when they get up out of the scan and they leave, they're walking out that door with a positive feeling.
We really started rough with our ideas, and behind me you'll see some of the sketches that we came up with, just pencil and pen, getting our ideas down. And we thought from the beginning what a powerful thing it would be to have a cross-functional team that allowed us to look at this from many different filters. We brought in child life specialists. We worked with Fern Schupeck, director of the Children's Museum here in Milwaukee.
We're thrilled that GE approached us. We serve, 200,000 children and adults every year. I think they felt that they really could, be driven, their project could be driven in part by the expertise that we could offer in terms of how to meet the needs of children and families. As an adult who's gone through scary medical testing, I know it's just tremendous anxiety. The difference with children is that, our ability as adults to explain to them what they can expect. Children are creatures of habit. They really rely on their senses to understand their world. As an adult, I walk into a hospital and I say, oh, I hate that hospital smell. For a child, it's why doesn't it smell like my pajamas? Why doesn't it smell like my mom? Why doesn't it smell like our kitchen? This is the essence of the childhood experience. We need to be more focused on the needs of children and families, whether it is in the context of medical procedure or early childhood development as a foundation for doing better in school. So, and this is another area where I think the GE team was incredibly receptive to the message that we're carrying, which is as a community, and I mean that in sort of a global sense, as a community.
So I hope that this particular experience that GE was doing was very helpful for you to understand that how we can bring about these changes at different levels. All right. So I'm going to focus upon journey mapping, which is more the area that I have dealt with in my healthcare forays into some healthcare providers as my role as consultant with DataCouch. So there are different ways in which we can approach journey mapping. Let us explore some of them. So there was a personal experience of a person. This person is Joe Tuan of Top Flight Apps. So he's a innovator and he's an entrepreneur who wanted to get a dentist appointment with many hurdles and hiccups, of course. So journey mapping helped this healthcare providers identify the pain points like long wait times, and poor communication, enabling targeted improvements for better patient experience. So this is an example of the journey map that he created for his dentist, and then he actually implemented it across multiple dental and other clinics in the USA. Now, this next case study is from the IDR Medical, which is a consultancy company based out of Switzerland, who are an international medical market research and consulting company. Now, they are a trusted advisor to the world's leading medical device and pharmaceutical companies, and you can see that there are different kind of patient journeys that one can come up, and this was a particular example for their specific plans. Now, let us look at something more severe in nature. So when we talk about a normal patient, when we talk about a patient who is in control of their emotions, who is in control of their thinking, who is in control of the cognitive abilities, the journey would be completely different from a person who is not in total control of their cognitive abilities. So dementia, as we all know, the common parlance term is what we call known as memory loss, but more clinical term is dementia, and there are multiple causes for this particular ailment. So transitioning between care settings can be particularly challenging for individuals with dementia, often resulting in heightened confusion and anxiety. Now, dementia, I guess that most of you should be knowing, is a broad term that is used to describe a decline in cognitive function that is severe enough to interfere with daily life. It is not a specific disease, but rather a group of symptoms that are associated with decline in memory, reasoning, language skills, and other cognitive skills, making it all the more important to map their journeys as closely as possible when they are going for healthcare plans or treatments. To address these challenges, a study was conducted by Alzheimer's Society of the UK to explore the use of journey mapping as a tool to improve care transitions for dementia patients. Now, Alzheimer's Society conducted a comprehensive study to enhance self-guided support for individuals affected by dementia. And this initiative involved extensive research, including interviews with 44 individuals across England and Wales, analysis of 1.2 million online conversations about dementia, collection of 400 online survey responses, and different focus groups with dementia support workers. Now, the findings led to creation of 7 personas representing typical users of Alzheimer's Society services, each accompanied by detailed experiences with journey maps outlining their actions, thoughts, feelings throughout the dementia diagnosis journey. And these insights informed the development of 4 major prototype services, ensuring a user-centered approach in delivering support. I would like to share one notable persona that was developed from this research. So this persona, so whenever you are designing a persona, whenever we are designing a persona or user-centered solution, we first of all create a persona, we attach an image to that person, we define the background, the characteristics, the feelings, the emotions of that person, so that we are able to understand and connect with them. That is what empathy basically means. So this persona was named Gillian. She is a general practitioner or a doctor, and the experience map for Gillian highlights the challenges faced by healthcare professionals or doctors in particular in diagnosing dementia. So there are multiple constraints. For example, there are time constraints during the consultations. The complexity of the symptoms, it can vary from person to person. The people who are surrounding the patient, who are taking the patient for this kind of consultation, they may not be aware of these symptoms. The patient themselves are not aware of these symptoms, obviously, because they have this kind of problem. The need for effective communication with not only the patients, but also with their families, and so on. By understanding Gillian's journey, the Alzheimer's Society identified opportunities to support general practitioners or GPs through targeted resources and training, ultimately aiming to improve the diagnostic process and patient outcomes. This study further underscores the importance of experience mapping in identifying the needs and challenges of both individuals living with dementia and the professionals that are supporting them, as well as their family members, leading to more effective and empathetic service design. Now, let me share a couple of ideas that were result of not only this study, but some other studies in the healthcare sector. So transitioning between care settings can be very, very challenging, as we have discussed, right? So another study that was titled Using Journey Mapping to Support Staff, Family Members, and Allies of People with Dementia During Care Transitions was there. I have the links for all these studies, and I would be happy to share with them at the end of this session. So in this study, researchers collaborated with staff and family members to map out the experiences of dementia patients during the transitions by identifying the key touch points and pain points, and they gained a comprehensive understanding. So first of all, they identified the challenges that the transition causes confusion and anxiety in dementia patients. That's the basic idea, right? Then the approach was that the researchers used the journey mapping to understand patient experiences, as we mentioned, and the outcomes was that the process revealed critical areas needing attention, such as communication gap, environmental stresses, and so on. So, for example, a dementia patient might be triggered by some sort of annoying sound. For example, a person might get annoyed with the sound of a train or a train whistle, or some other kind of repeating sound like tuck, 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 that might be happening due to some sort of repair work that is going on in the clinic or the hospital. So all these things are trigger points for these patients. These can be trigger points, right? So addressing these issues led to development of targeted strategies that significantly improved the patient well-being during transitions. Now, the conclusion of this study and the previous one is that these underscore the value of journey mapping in identifying and addressing the unique challenges. By visualizing the patient experience, healthcare providers can implement more effective and empathetic strategies to support the vulnerable population. Now, how do we create empathy maps? If I want to create an empathy map for a healthcare provider, or I want, for example, I'm an educator. Most of us who are participating in this faculty development programs are part of the faculty of some institution. I want to create an empathy map, or I want to create a journey map for any of my students or any of my researchers or any of my fellow colleagues who have joined the organization only very recently, or let's say for the controller of examination or for the registrar or for any other role. So how do we create those empathy maps or journey maps? So we are going to once again focus on the healthcare sector, right? So it is very crucial for delivering effective and compassionate healthcare for our the target audience. So let us first of all understand what is the definition and the purpose of an empathy map. So it's a visual representation that captures what the user says, thinks, does, and feels in this thing, right? So in healthcare, it helps us to delve deeper into patients' perspectives, allowing us to tailor our services to better meet their requirements. So there are 4 key components, as I just mentioned: what the user says, thinks, does, and feels. So typically, it is divided into 4 quadrants. We are just going to see what these 4 quadrants are. So what the patient says, how they verbalize during interactions with the healthcare professionals or with their family members, how they describe their symptoms and so on, what they see. What are the patient's thoughts, beliefs, and motivations for saying the things that they are saying? What are the actions and behaviors that the patient exhibits? For example, if a patient is going through some sort of pain, are they clenching their teeth, or are they shouting out loud, or are they requesting you to give more painkillers and so on? What are the actions that they're exhibiting? So what the patient does. And finally, what a patient feels, the emotions the patient experiences throughout their journey. So we can capture those emotions. So for example, you must have seen a physiotherapist or an orthopedician tapping with a metal rod or metal device on the joints of a person who has just gone through some sort of surgery or something, to check whether there is the nervous sensation on those parts or not, right? Sometimes a neurosurgeon also does that to check the nervous system reactions or reflexes. So those kind of things can help you gather the feeling of the patient for that particular aspect. By mapping out these aspects, we can identify the unmet needs, the pain points, and the opportunities for improvement in our patient experiences. So when we use this quadrant approach, it fosters a more empathetic understanding, leading to enhanced patient-centered care. So if there is any question up to this point, please let me know. You can give me a thumbs up if there is no question, or if you have any question, you can unmute, or you can. All right, thank you very much. So now we have seen a few examples that are from out of India. We also need to have an example whether this thing is being implemented in India or not. So I have this case study which was published in Hospital Management Asia, and it was conducted at Apollo Hospitals, which is a very large chain of hospitals in India, as you all know. So how they integrated empathy mapping into their staff training programs, and this initiative was aimed to instill more empathetic approach among the healthcare staff, ultimately enhancing patient-centered
care. At Apollo Hospitals, patient-centric care is at the heart of everything we do. One of our transformative approaches is empathy mapping. Empathy maps are powerful tools that allow healthcare professionals to step into patients' shoes. By visualizing the patient's journey and mapping their feelings, caregivers can identify pain points and challenges. This project has revolutionized staff training and patient experiences. Staff showed improved empathy skills, and complaints were reduced by 78%. The impact was evident. 83% of oncology staff gave positive feedback. We believe this innovative approach will foster a more compassionate and patient-focused healthcare system.
So, as was mentioned in the video itself, the main two primary objectives of this particular exercise was to identify the patient pain points through empathy mapping, to uncover the common challenges in patient experience and develop targeted interventions to address those specific pain points. The second objective was to establish an ongoing training program for their healthcare staff, which includes not only the hospitals, doctors and the nurses, but also the support staff that are all around them. So it can be the lab technicians, it can be, let's say, the people who are sitting at the reception, the support staff, the security staff, and any other staff that is out there in the this thing. So how to integrate these things in the continuous staff training for better outcomes. So some of the actions taken by Apollo Hospital was, first of all, the development of a unique empathy map model for their particular patient personas. A design thinking tool was created to help the staff understand patients' emotions, thoughts, experiences at various touch points during their healthcare journey. There was a very comprehensive training program that was designed and undertook, and there were multiple iterations. Case studies were done. There were multiple exercises, practical exercises that involved healthcare professionals like doctors, nurses, support staff, and so on, to participate in those exercises, in those scenarios. And real life scenarios were there to familiarize the staff with empathy mapping with the help of videos and storytelling. Then there was a pilot and rollout, which was conducted with oncology staff at a particular branch or location of the Apollo Hospital, which was followed by a broader rollout across different shifts to ensure widespread participation across the entire Apollo Hospital chain, right? So these were some of these things. Now, some of the outcomes, as was mentioned in the video itself, 83% of the professionals reported that training enhanced their understanding of patient-centered care and empathy, leading to better communication with the patients. And to look at the other side of the coin, there was a 46% improvement in patient experience index, the feedback that they actually get it from every patient at the end of their care when the discharge ticket is actually given to them. And patient complaints decreased by approximately 78%, a huge drop. So patient felt more understood, supported, and valued by the hospital staff. So you can see that the number of complaints are dropping by close to 80%. That's a big achievement of this particular program, and that is happening right here in India. So by incorporating empathy maps into our practice, we can gain a deeper understanding of our patients' experiences, leading to more effective and compassionate care. Now, the question is that if I want to create an empathy map for my healthcare staff, for my patients, for anybody else, or for example, as I mentioned, that we all come from different academic settings. If I want to create those empathy maps for my team, how do I start? Where do I start? Right? So I'm going to share a few resources with you. There are multiple resources. These are some of the resources that we may have tried. I'm saying we may have tried. I'm not saying that we have tried these. So there is no endorsement to these specific resources, but there are multiple resources that are available. And it is not necessary to get attached to by these resources or by handicapped by the unavailability of these resources. I just want to share that just like the GE engineer started with plain drawings on a whiteboard or on a piece of paper, you can start your empathy mapping even with a pen and paper. You don't need any tool, you don't need any gadget to do that, right? So some of the very popular tools and some of the very important tools could be, there is a Phil Life team. So there is a video, how do you create empathy maps? So that is a YouTube video that you can use. I've shared this thing. So there is one from NN Group. This is a complete lesson, self-paced learning, self-paced pre-recorded videos are there. You can go through the NN Group website and check out the empathy mapping. So they are into UX, UI design. They are not basically into healthcare, but empathy mapping actually helps different personas and different verticals also. It's not only limited to healthcare. Then there is the Playbook UX. So it tells you how the empathy map works and what it is and how do you create this empathy mapping. So these are some of the very important or popular tools that are out there, or some courses out there which you can actually look at, right? Now, we have to understand when we are focusing about persona development in healthcare, when we are talking about user-centric empathy mapping or journey mapping, we want to make sure that we are actually identifying our target audience the correct way. So we need to identify, if you recall from the previous example from UK's Alzheimer's Society, there was a particular persona that was created of a general practitioner, Gillian, who is not a specialist for neurological issues like dementia, but she is the first point of contact. She is the primary healthcare giver. She is the PHC or primary health center in Indian context. She is the doctor sitting there, and she has to first of all understand that the patient is going through dementia, and then she can recommend and refer the patient to a specialist for specific treatment. So we have to understand that persona development in healthcare is very, very important, because how a specialist is going to approach the same patient is going to be totally different from a general practitioner, right? Similarly, how a clinic staff would be completely different from a lab staff, and those kind of things. So we have to first of all understand what is persona development, and before that we have to understand what are personas. So personas are semi-fictional characters that are crafted from real patient data and insights. They encapsulate the demographics, behaviors, motivations, and challenges of specific patient groups, enabling the healthcare providers to tailor service and interventions effectively. So for example, if you would be building a persona around me, the facilitator for this session, it would be that this is a male who is in the middle 40s of his age, and the lifestyle is mostly sedentary because my work is a desk job, and almost 8 to 10 hours a day I sit in front of a machine and do my work, whether it is conferencing, whether it is delivering sessions like this, whether it is working on any projects and something. Traveling is there, then some sort of workout or some sort of walking, and those kind of things are there. Some other challenges, my dietary preferences, all those things would come into the semi-fictional characteristic of a particular thing. And you would see that many people are going to fit into that particular spectrum. But if some people do not fit into that spectrum, then we will create a different persona, and we will try to identify what are the differences between these two. If there are many differences, significant differences, then we will create a different persona, otherwise we will not, right? And we have to identify the characteristics which are specific to our requirements. There can be thousands of characteristics which may be relevant from a comprehensive or holistic healthcare perspective, but not from the specific perspective, let's say for a dementia patient or for a diabetes patient. So we have to be focused on that also. Then how do personas matter? Why do personas matter in healthcare innovation? So they first of all help us with enhanced understanding of nuanced of diverse patient needs, moving beyond generic assumptions that we have for patients, right? They also help us in informed design. They guide in the creation of patient-centered solutions that ensure that services and tools align with actual patient experiences, and obviously better and improved communication with crafting messages that resonate with these specific patient groups. So for example, you cannot say the same things to a person from a village in Rajasthan that you would say to me. So for example, I'm sort of a well-read person. I'm an English educated person. I have command in 2 languages, Hindi and English. And it can be understood that because I'm well-read, I may be understanding of some sort of healthcare implications or concerns that might be there with me or my family members, right? So a doctor would be delivering the message, even if it is a bad news to me, in a different manner. But the doctor would be advised to deliver the same communication, the same message to a person from a village in a very, very different manner, right? So communication, how do you communicate something, is very, very important, right? Finally, let us consider an example persona. So let's say the name is Rajesh, the age is 55, the condition is diabetes. The goals for this person or this patient is that we have to manage the blood sugar levels and reduce the hospital visits. The pain points for this particular person is that there is limited education about the diabetes and lack of support at home. So probably this person is coming from a background which is not very advanced when it comes to education or finances. So it is not coming from a background of privilege, and that is why we have to address these pain points, right? The solution would be that we can develop an AI-based chatbot to provide personalized guidance and support. Now, why I'm saying AI-based chatbot? Very many people, even if they are having limited education or they are having limited resources, very many people in India today have a functional smartphone. Now, and most of them use WhatsApp. If they have smartphone, then probably they use WhatsApp. We can create a chatbot which can answer queries in voice messages. So all these chatbots are already there. We are probably using them. There is the Meta AI, which is integrated into our WhatsApp. We can integrate our own chatbot, which can respond to voice communication from the patient and give the responses in voice communication in their native language. It may not be the Rajasthani or Punjabi or Marathi accent that they may bring to the table, but they can still give communication in clear Hindi or clear Marathi or clear Gujarati or clear Punjabi or whatever regional language that we want to give the communication to the patient. For example, the patient might ask, "आज मैंने 4 जलेबी खाई, मैं उसके बदले में क्या करूं?" Now the chatbot would have some understanding. The data that would be fed to the chatbot would have that, okay, jalebi is a sweet in India. It's a dessert in India, which has a very high calorie, which is a very high fat content. And how do I address this situation? So they might suggest that, okay, after having this thing, you can have a light food, you can have a more fiber diet, you can have this particular medicine, or you can consult your doctor. If you are feeling these symptoms, go and consult your doctor. But if you're not feeling the symptoms, only the blood sugar is high, you can go and do these things, let's say a little bit of workout or skip the evening meal and so on. So this chatbot can be very, very effective because the person is not well educated. So it would be difficult that they would be able to read what the chatbot is typing. But if the chatbot is giving this thing, yes, Mr. Ravinder Singh.
Sorry, sir. It will done by mistake, na?
Oh, no worries, no worries. I thought there was a question. No worries. So these things can help the patients by addressing their pain points, because for a person of this persona, we would also understand that it would not be very easy for them to visit the doctors very often, right? All right. So once again, before I move ahead, if there are any questions or any thing, please let me know in chat. Okay, sorry, there was a question. Can you please suggest any good books, application of design thinking to medtech or healthcare? So, Mr. Chandra, I did suggest those 3 resources. You can start from there, and then going ahead, you can take on other resources. And certainly, the organizers of this event can share the links that are available in the presentation. I hope that addresses your query.
Yes, sir, we will sure.
All right, thank you very much. Okay. Now, for healthcare professionals or healthcare providers, are there any specific persona development tools that are available? Yes, there are. And I would say the tools that I came across were they were subscription based, they were paid tools. They are great tools because they have been tested and tried around multiple hospital chains all across the world. But mostly they have been tried out in very high-end hospitals. So I'm not sure whether, if as a healthcare professional, whether your hospital chain would be able to afford them or not. That is a completely different discussion. But that should not stop you basically from accessing those tools which are available outside of these specific providers. For example, you can start doing the journey mapping on your own also. The specific tools that I'm going to share just now, they are more aligned towards healthcare requirements, right? So the first one is basically from Edfire Health. So they help you create impactful patient personas. Then the second one is from Miroverse. They help you design the UX for health personas for solution development and so on. Then you have the third from Visme, which once again provides you health persona templates that you can use these tools for, right? So once again, the links are there in the presentation that you can use later on. Now, this is something that we have been doing at DataCouch. We have been integrating AI chatbots for past couple of years. More than that, I guess, in different ways. So earlier it was text-based chatbots, then voice chatbots came, then LLM models came, and we tried to integrate them. there was a few failures, but now it's been a very resounding success in this thing. Now, mental health has become a very big issue. So, for example, I'm the I'm the father of two sons. One is a teenager, and the other one is going to become a teenager the next year. Now, the environment in which they live, the competitive environment, the peer pressure, the social media, the internet, the accessibility of all types of content that is available online and so on, all these things can lead to mental health issues among any person, whether it is a 5 or 8 year old, or whether it is a 40-year-old like me, or whether it is an elder person, right? So it does not matter. Now, when we integrate artificial intelligence into mental health care, it can open new avenues for support. For example, AI chatbots are transforming how individuals access mental health resources. So, first of all, there is the issue of accessibility. It is, for example, the therapist that I visit. For example, I'm visiting a therapist for any kind of help that I want to receive. The therapist office timings would be from, let's say, 9 to 5. But if I want the help beyond those times, it would not be easy to get the access. But if I have an AI chatbot that has these kind of data drilled into it, it can provide me 24/7 emergency health support, at least. If they cannot replace the therapist, but at least they can provide some sort of emergency health support, right? Affordability also comes into picture. But if we are able to scale such chatbots, if we are able to design such chatbots and deploy them at scale, then affordability also can be reduced. Because if any one of you knows, a therapy session right here in Jaipur can cost you anywhere between 1,500 to 2,500 rupees for a session of 45 to 60 minutes, right? So these can be a very, very cost-effective solution also. It can be very, very personalized also. Because as the interactions with an individual increases, the chatbot would understand the feelings and the symptoms of that particular person and would be able to give better outcomes. Let me once again share a very, very quick case study with you. Now, this is a very long video. I'm not going to play it completely with you. I'm just going to play a very small part of this particular video with you. Okay, sorry. I guess the video is not working. All right, no worries. This case study once again is linked in this this thing. Because this particular video is from 60 minutes, it's a program of CNN. Probably because of copyright issues, it is not allowing me to play it in a presentation like this. All right. So that particular video was about a mental health therapist, clinical therapist, who integrated these AI chatbots for giving emergency healthcare, mental health care for her patients and patients of others also. Now, as you have seen, we can use empathy mapping, we can use empathy design in any kind of situation when it comes to healthcare solutions, right? So innovation in healthcare encompasses various dimensions, and each can contribute uniquely to enhancing patient outcomes and system efficiency. So let me quickly go through these aspects. So there can be product innovation, which is development of new medical devices and pharmaceuticals that is beyond the scope of my skill set as well as my company's skill set. But anybody who's from a medical device organization or anybody who's from a pharmaceutical company knows about this. Then there can be process innovation. So implementation of telemedicine, remote monitoring, AI chatbots, those kind of things. So there can be process innovation. For example, how to better administer vaccines, or how to better administer whether it should be given in the form of, let's say, how do you transport the medicine from the factory to the doctor's clinic in a refrigerated and controlled environment. Those can be process innovations. Then tech innovation, for example, use of artificial intelligence and machine learning in providing healthcare support to a patient like Rajesh, the persona that we discussed, or to a mental health patient. Then there can be service innovations. So service innovation can be related to, for example, the empathy mapping that was done by Mayo Clinic for waiting areas and patient interaction. Those kind of things can be service innovations. Then business model innovation. How do we adopt value-based healthcare systems in our systems? So everything, when you try to implement something like empathy in your business, it initially adds to initial cost. And you are not sure whether it is going to be, there would be any returns on this thing. So, but the example of Apollo Hospital showed that there was a drop of close to 80% in the patient complaints. So if as a patient or if as a caregiver for a patient, I'm visiting Apollo Hospital and those kind of environment, those kind of interactions leave me cared, leave me understood, leave me valued, then certainly next time I'm going to recommend everyone in my circle that, okay, go visit the doctors at Apollo Hospital. They are the best. Because in healthcare, the word of mouth is the biggest way to reach out to more patients, which is the target audience or the uh, customer base for a hospital or a healthcare provider, right? Moving on. The final is the social innovation. So community health initiatives and preventive care programs. So for example, the Pulse Polio program, which is the world's largest vaccination program against the polio. Those kind of things can be communication health. So it again comes to messaging. It again comes to those kind of aspects that we discussed. For example, Rajesh cannot be given the same information in the same manner in which that same information can be transferred to me. So these things, and how do we address the same issue in larger public? So for example, there can be millions of people who belong to the same social strata and educational strata like Rajesh. How do we address the pain points for those people? How do we communicate with them so that anybody who is pre-diabetic does not become a diabetic? Anybody who is diabetic goes for a checkup, understands their symptoms and goes for a checkup and starts their diabetes management. And anybody who's healthy right now, who's not also even pre-diabetic, maintains a healthy lifestyle so that they do not cross the line, right? So that is part of our social innovation thing. Now, understanding these diverse types of innovation enables healthcare professionals to collaboratively enhance the system effectiveness and patient care quality. So the healthcare professionals are the biggest stakeholders, because if you do not take the initiative, a person like me, a consultant, a UX designer, or anybody else cannot bring about that change. Now, some closing thoughts and call to action. So first of all, we should be and we should all be understanding the value of empathy as a catalyst. I urge you, all of you, to reflect how you can weave empathy into your daily interactions and decision-making process. Whether you are a teacher, a doctor, a nurse, a patient, a caregiver, a support staff, a student, a researcher, whether it is in your personal interactions or professional interactions, does not matter. Consider adopting practices like active listening, patient journey mapping, and empathy mapping to gain deeper insights into these things. Active listening is something that we all can do in everyday work also. Then there should be a commitment to action, implementing empathy. So if we can transform our insights into action, there was a famous quote, I may misquote it. So there are a billion ideas, but only a few executions, right? So it does not matter what your idea is. Yes, Ms. Nargis Khan, you may have a question. I think you have raised your hand. All right. So translating your ideas into actions, it does not matter whether you reach the perfection. So we have to always focus upon progress over perfection, because perfection is a mirage. You can never reach perfection. Something which is perfect today may not remain perfect tomorrow because of the change in the dynamics of the environment in which we operate, right? So continuous progress, continuous learning, continuous innovation is something that we have to focus upon. So implementing empathy in our work, in our culture, in our processes, in our products, in our social interactions is very, very important. And finally, there has to be some sort of commitment to action. That how do we bring about organizational commitment towards it? How do we get the buy-in of our stakeholders, whether it is the management, whether it is the support staff, whether it is the nursing staff, whosoever are involved. So remember, the path to innovation begins with empathy. By placing ourselves in the patient's shoes or anybody else for whom we are designing a solution, we can drive changes that are both impactful and lasting. So thank you for your time, your patience, and your empathy by attending this session. If you have any questions, I would be happy to answer them. If you have any feedback, if you have any comments, if you want to share any experience also, that would also be great.
Good evening, sir.
Good evening, Ms. Sangeeta.
Sir, it was such a nice session, sir. Sir, I want to ask a question, sir. So is there, in India, in our country, so many people cannot afford the entire charges at a time, means for the time, hospital charges and bill charges, everything. So, is there, we can design any healthcare system in such a way that there can payment in installment or in different way?
Certainly, certainly. That's a very great call out, Ms. Soni. Healthcare bills actually bring about, it's a very known fact and anecdotal fact also, that every family, especially in the lower income strata of India, is just one medical emergency away from poverty. That's the reality. So interventions like Ayushman health insurance scheme by government of India, or the CM Ayushman Yojana, which is the earlier in the Rajasthan, the previous government was running it as the Chiranjeevi scheme, and now it has been renamed to Ayushman Yojana and merged with the central government scheme. So those things actually bring about those aspects. So, but still the problem is that when a patient is reaching to a private hospital with the Ayushman card and telling that, okay, I'm insured under this particular scheme, the hospital are facing problems in, let's say, getting the dues from the governments, or sometimes the government is holding the dues because they are seeing that some hospitals are having very high claims for a particular procedure which does not require those many interventions. So there is a lack of trust between the hospitals because they are not getting their dues from government, and there is a lack of trust from the government because they are not getting the verifiable information from hospitals. They are seeing that, okay, they are trying to game the system. So once again, administrators, in this case, because it is government machinery involved, so probably the people such as IAS, RAS officers, they can get involved and they can identify the pain points of the people. The hospital administrators, they are saying that we have submitted 100 claims, but you have only accepted 25, and 75 either are rejected or are pending. So they can identify these things, and empathy mapping can actually work there also, I guess.
Okay, sir. Thank you, sir.
All right. So Himanshu Singh has raised hand. There are other raised hands also. So Himanshu, please go ahead if you have anything to share. I'm also looking at the chat. Himanshu Singh. Dr. Savita Agrawal has a very great comment where medicine does not work, empathy works wonder. Thank you, Dr. Savita Agrawal. There was one Mr. Welcome. There was
Thank
one
you, sir.
Mr.
It was
Puneet.
really a wonderful session. We came to know about so many things. Nowadays, actually, in present era, it is required. Actually, everyone is busy in their own life, and they are just lacking the communication with family members itself. So,
right.
Definitely, if we will be having more communicative and सर कहा गया है कि जितने ज्यादा दोस्त होंगे उतने ही ज्यादा कम्युनिकेशन, उतने ही हंस मस्त रहो आप. वो गलत नहीं थी, जो पुरानी चीजें थी, शायद उसी का इफेक्ट है कि वी रिक्वायर्ड द एम्पैथी.
यस सर्टेनली. सो जो आपने कहा, जो दोस्ती वाली बात है, तो वो एम्पैथी में ही आती है, बिकॉज फ्रेंड्स अंडरस्टैंड यू लाइक नो वन एल्स डज. सो आई अंडरस्टैंड वेयर यू आर कमिंग फ्रॉम. सो थैंक यू फॉर दिस.
थैंक यू सो मच सर. थैंक यू.
वेलकम. Any other questions, any other feedback, not feedback, but any experience you would like to share, that would be great. Dr. Ajmera, my presentation is over. I guess there are no more questions. There were a few raised hands, but they are not unmuting and asking their question, or I don't see their questions in chat also. So you can take over. My session is over. Any one of the organizers?
Yes, sir.
Thank you so much, sir, for this wonderful and informative session. So I don't think so anyone having any query. And sir, sorry, I apologize for the slip of tongue. I mistakenly said sequence language.
No worries, no worries. You I do not know anything that you know, probably. So I'm probably
no sir. Thank you, sir, for your understanding, sir.
You're welcome.
Okay. And so, as we conclude, I hope we all have gained a deeper appreciation for the power of empathy and user centered research in healthcare. It's not just about data and diagnosis, it's about understanding the human experiences of illness and care. Because ultimately, the best healthcare isn't just about treating disease, it's about understanding the cause and having the empathy for the patient. A sincere thanks to Mr. Mudit Khetan for sharing his knowledge. We are so grateful for your willingness to share your expertise and passion with us today. So thank you, sir.
Welcome.
So now we will wait for a few minutes and then we will further continue towards the next session.
Dear participants, we will continue the next session at 7:30 p.m. Please join again. Thank you, Mudit sir, for your session.
You're very welcome, Dr. Rudmira. Thank you for inviting me.
Now, let's move forward to our next session, which is based on problem definition and opportunity framing, which is going to be given by Ms. Daksha Marothia. So, we are honored to have Ms. Daksha with us today to share her expertise on this essential topic, that is problem definition and opportunity framing. Ms. Daksha is a seasoned user experience design strategist with over 10 years of experience crafting intuitive and engaging user experiences. With a strong foundation in user research, wireframing, prototyping, and usability testing, she has collaborated extensively with cross functional teams to translate complex user requirements into seamless customer centric designs. Her expertise lies in applying user centered design methodologies to solve real world user experiences challenges, ensuring that design decisions are visually compelling, data driven, and highly functional. Beyond her technical expertise, she is a passionate advocate for innovation and continuous learning. Today, with a keen eye for identifying potential, she will share her secrets for framing challenges as opportunities for innovation and growth. Join me in welcoming her as we explore the exciting world of problem definition and opportunity framing. Ma'am, I would request you to please start with the presentation. It's all over to you.
Thank you so much. Hello, everyone. I am Daksha. I have already been introduced. Just one request I have from all of you. I would want everyone to engage more in the sessions because this is a workshop. I would like everybody to be more attentive and more proactive. You might answer the questions or do the activity in maybe your own space and like answer in chat. But is everybody okay with that idea? Please raise your hands and then I can share my screen. Great. Great. Thank you so much. I will just share my screen. Let me know if you're able to see my screen whenever I do so. Is my screen visible?
Yes, ma'am.
All right. Thank you so much. So I'll just present and yeah. So the topic that we will be discussing, and also I would not be able, so whoever is the facilitator, I'm sorry, ma'am, I'm missing your name. I might not be able to see whoever is raising questions or answering the questions. So I might go back to either the window for like the call window, or if anybody can help me with the questions and like the answers. Thank you. So the statement that we are discussing today in the design thinking spectrum is problem definition and opportunity framing. So as Mudit sir has very well defined how empathy works and why is it so important in not just healthcare, but even in design thinking, why is it so important? We just want to understand that how problem definition and opportunity framing are also interrelated with empathy. So here, when you're talking about problem definition and opportunity framing, these are two different aspects of design thinking, not just design thinking, but also when it comes to any industry or any sector. So healthcare being one sector for it. But when we are talking about problem definition, we are talking more about the empathetic part of it. We are talking more about the users. We are talking more about how we are defining problems and trying to solve that problem for a particular set of users or for a particular target audience or for a particular person for that matter. But when it comes to opportunity framing, we are also talking about from where we are coming from. So as a doctor myself, if I'm catering to a problem or looking for an opportunity to solve, I would be looking at a more business point of view from my angle. Or if there is, suppose there is a insurance company who is also into healthcare sector, they would be looking at more from their angle how they can frame that problem and make it into an opportunity. So we are going to be discussing and like doing more engaging activities for this particular thing later. I just want to give you an idea of what is ahead of you. So the agenda for this particular session would be, we would be talking about why does problem definition matter so much? So, and how exactly do we frame these problems? Then we are also going to be talking about opportunity mapping. So from a problem, obviously, you'll always have the opportunity to do something. So this is your agenda for today's session. And I would like to do one activity. So any one of you who can who can guess which of these statements is not true. Reema ma'am, can you give the people access to unmute themselves and maybe talk out loud?
Ma'am, it is allowed.
Okay, great. Thank you so much. Anybody, I welcome everybody on stage. Can anyone guess? I will just read the statements out loud. Over 40% of healthcare workers experience burnout due to workload and stress. Only 60% of medications prescribed are taken as directed by patients. AI-driven diagnostics are more accurate than human doctors in all cases. Can anyone guess which one of these is not true?
Third one is not true, ma'am.
Third one is not true. Any more guesses?
Third one is not true.
Yes, ma'am. Third one is not true.
Is that a majority guess? Anyone against that question, that answer? Guys, you'll have to speak, sorry. There's no other choice.
Last one.
Last one. All right. So yeah, AI-driven diagnostics are yet not true in all cases and more accurate than human doctors. So yes, you guys are absolutely correct there. I'll start with the how problem definition matters. So there's a very famous quote by Charles Catering that a problem well stated is a problem half solved. Can you guys give an example of how that works, especially in healthcare? Like a very common example. Anyone? Do you guys all
Madam,
go to? Yeah, sorry.
it is according to the statement, well begun is half done.
Yes. But can you quote any example from your day-to-day activities or day-to-day life with regards to healthcare or without this regard, where you say that you have defined a particular problem and then you feel that it is half solved? हम कहते हैं कि एक बार समझ आ जाए तो हम आगे कर लेंगे, ऐसा होता है सबके साथ?
Yes, madam.
Do you guys all go to, I have heard a lot many times when I go to a doctor and I have hearing, and I'm sure all of us have been hearing this from our parents, कि डॉक्टर के पास जब जाओ तो उनको सही सही बताना कि क्या हो रहा है, पेट में दर्द कहाँ हो रहा है, हाथ में दर्द हो रहा है तो एग्जैक्टली किस जगह पे हो रहा है. Have you all heard these statements from your parents while going to the doctor?
Yes, ma'am.
So these are very clear examples of how do you define a particular problem. It's a very vague statement to say that I have stomachache. But then to identify stomach being a very large area of your body, how do you identify where exactly is the problem? It could be your gallbladder, it could be your liver, it could be your uterus, it could be anything. So when you're talking about pinpointing a particular problem and identifying the exact root cause of a particular problem, this is why problem definition becomes a very important part of even empathy for that matter. Because until and unless you are not aware of the exact problem, you won't be able to empathize with the particular person. So when you're talking about users, say in healthcare sector, we are talking about multiple users. A Fortis hospital is catering to a large amount of users because they are catering to they have a lot of department. They have a psychology department, they have a gynecology department, they have patients for diabetes, they have patients for maybe heart patients. So a lot of multiple different sectors when it comes to like even healthcare, until and unless you pinpoint on the particular problem area, you won't be able to make a solution for them. So it's always better to clear, like clarify who you are solving the problem for, or who is actually facing the problem. So it's always advised to avoid assumptions in all cases. When it comes to a problem or defining problems, uh, the major thing that plays a role here is user research. So as Mudit sir had like shown various case studies which talk about user research in very extensive format. So while we are talking about user research, why we do user research and how do we identify a problem from there would always like go back to creating a persona, identifying the pain points of a particular user, consolidating all that data, and then you can define a particular problem. So this is why defining a particular problems become a very important aspect of user research and even ideation when it comes to like design thinking process. So it always helps in understanding the root cause. I would welcome questions after every slide. If anybody has a question, please let me know. Or if I'm good to go, please give me a thumbs up or anything. But I cannot see thumbs ups. Okay, I'll move on. If anybody has a question, please raise. So what is problem framing? When we are talking about problem framing, the structuring of a particular statement becomes problem framing. Consider this as an English grammar activity or Hindi grammar activity where we are talking about active voices, passive voices. When we are writing down a question, so I would request all of you who are here to think of, like you can write it down on a paper, not particularly say it out to me or in the session, but what I would like you to do is think of a problem that you are facing, especially with regards to health, your parents health, your spouse's health, kids health, like any of that sort. Or you have seen a particular problem, an issue that presses your nerve uh, very much in healthcare sector. So something like that, and you would want to like write a particular statement that defines who it is affecting, what is the exact context of that particular problem, and what are the constraints, like why do you think that problem exists. So suppose I would take an example of a diabetic patient who has to check their sugar levels every day. That could be a problem statement. So the constraint could be, or who is affected could be the person who is affected, say the patient, a diabetic patient. Then understanding the context, what exactly is the problem. My problem is, suppose I am a diabetic patient and I need to regularly maintain my record for insulin, or like maintain my sugar levels. That could be one thing. Then constraint could be I might not get time in my day-to-day activity, or I might not have the machine to do it every day and I have to travel to the lab and get it tested every day. That could be one of my constraints. So I would like every one of you to just write any statement that you think that could be a problem. So that should be a problem statement. Should I move ahead? One of the techniques to identify a problem or define a problem in a more clear manner is to ask 5 why questions. So that could be either related to, so in my case, if I say that if I have a problem, the very random question somebody asked that there are prices increasing for, like there might be the rate of these hospitals are increasing, consultancy charges are increasing. So that could be one of the problem. I took an example of readmission rates in my high hospital readmission rates. So that could be one of the issues that we talk about. So why, when we are talking about this particular example, high hospital readmission rates, then first, why would lead you to patients don't follow post-discharge instruction. Then it could then lead to multiple different whys. Now, if you ask why, people would say instructions are too complex. Then, if you ask why, doctors don't simplify medical jargons. Why no structured discharge education program? Then why lack of hospital resources? So now, if you see, the root cause becomes lack of hospital resources. So in case like high hospital readmission rates, which is directly related to the patients, is now indirectly related to, or like related to hospital staff. So if you increase the staff rate, which was not the first solution, when you talk about the surface level problem, the root cause always gives you the solution for that surface level problem, and could also highlight multiple different surface level problems when you think about it. Any questions so far? Okay. Another major, yes, sorry. Somebody said something.
Ma'am, Mr. Chandra want to ask question.
Okay. Is it in the chat? Can you please iterate?
Mr.
Ma'am,
Chandra,
actually,
please.
we are talking about here problem definition.
Yes.
But we are also discussing about the root cause actually. So we need to define the problem before going for a solution, right?
Can you? I completely understand. So root cause will only be defined. That is, so to define a root cause, we are talking about problem definitions. While we are talking about problem, why is a problem important? You need to understand the root cause of any problem. While we are talking about these problems, like a way question has to be there in your mind to reach to a particular root cause. While like Mr. Chandra, if I may ask, is there any problem that you're facing? And it's a random question. You can have a very general statement that, like, I could say I have hair fall issues. So any random thing that you would want to highlight.
Yeah, okay, ma'am, you can continue.
No, this was a very good example. Can you please highlight any problem, or any one of you, if you
Yeah,
can
say for
give me a very
example,
surface level
yeah,
question, surface
I
level
want to reach
problem that you're
office on
facing?
time. Yeah, ma'am, actually example problem statement is like,
Hmm.
I'm always reaching almost 80% of the times reaching, half an hour late to office.
Okay.
That is my
That
problem
is
statement. That is my
okay.
problem
And
statement. But
why?
I could not reach office, and always I'm reaching half an hour late. But
But like
when we are talking,
why if you think about it, why you're reaching half an hour late?
oh, okay, I got it, ma'am. Actually, see, my understanding of I'm talking about the initial user problem definition versus you are talking about after root cause. You frame some statement of problem where you start addressing. Yeah, I got it now. Actually, so.
Yes. So when you're talking about problem definitions here, these are, so first level of questions that you'll get are always surface level questions while you do the user research and while you're stating these questions. So something as surface level as I'm reaching to office late, or I'm not able to get the healthcare benefits from, like, if government is like giving some schemes for healthcare and I'm not able to access it as a rural citizen. So these could be very surface level problems कि भाई हमें तो पता ही नहीं चला था कि ऐसा कुछ हो रहा है. These could be very surface level problems, and then when you identify the root cause of it while you are defining these problems, the root cause might be that one particular RAS is not like taking all the funds and not giving it to the district for use. So that could be the root cause. So the identification of these problems is always because you want to identify the root cause. So while you are doing problem definitions and while you are framing these particular problems, this is only to identify the root cause of that particular problem so that you can work on the very root cause rather than working on the surface level problems. So the whole idea of UX in general or business strategy in general is while users are looking for something, they don't understand how deeply rooted that could be. Please let me know if you guys have any questions related to this. And if I was, Mr. Chandra, if I was able to answer your question.
Yeah, ma'am, actually, maybe over a time you can show some sample statements.
The sample statements, yeah, I do have examples.
Yeah, okay, ma'am.
Excuse me, ma'am.
Yes.
Question.
Hello. Yeah, please.
I'm audible or not, ma'am?
I can hear you.
Okay. Actually, you're talking about problem statement, right?
Yes.
So I want to ask this: these Apollo and Max hospitals, big hospitals, very costly hospitals,
Yes.
basically lower economic peoples, lower financial peoples cannot reach them easily.
Yes.
So, so it may be the problem for them, or I can say why they can't reach them easily. Is there any scheme in these type of hospital? Because I think they provide so much good care, matlab, effective treatment as I listen about them. Actually, I never reach them for good luck. But I want to know, is there any scheme that lower middle class can reach these hospitals easily?
I'm not too sure about schemes that allow like
So there is a solution of this problem state. This is also the problem statement, no?
this is again a problem statement, and I was coming to that.
Yeah.
So the problem statement is not getting effective or good healthcare system within uh, in a reasonable price. That could be a problem statement that we are dealing with, or
Yeah.
talking about more hospitality in government hospitals. So these could be the problem statements that we are talking about. So while we are doing the user research, if this is our problem statement, our users become the middle class people, or the lower middle class people, or maybe the rural area people. Those become our target audience. So while we are defining our problem, or we are trying to identify the exact problem, our who is affected is very well defined here. Like people who cannot maybe afford like a high-end hospital, Apollo and AIM, all these hospitals, people who cannot afford these sort of hospitals or private facility hospitals. When we are talking about context, we can always talk about why are these facilities not provided in generic hospitals, or SMS, like hospitals like SMS, or hospitals like any hospital in Jaipur for that matter. Then what are the constraints? So then we are talking about the business who owns these particular hospitals. So if a government body owns the hospital, how much is the budget allocated to that particular government body? If a private sector owns that hospital, how much are they invested in the regulations, and how much are they invested in a better healthcare system? So all of these things then can give you a particular problem statement which is defined, which is very well constructed. So if you ask all these whys, you would always come to one particular statement. So suppose, like, this is one example: patients wait too long in hospital. This is one example like yours. Like, patients do not get good healthcare benefits in regular hospitals. This could be a very regular statement. And to redefine it after user research, after you have put down, jotted down good statements or facts within your statement, then you can redefine that particular problem. So like in this case, I'm pretty sure that I am not sure of the answers what you are asking to me. So I'm not sure what are the government bodies regulating these big hospitals, and how to identify where we are lacking in a regular system to give all these benefits in regular hospitals. So in this case, I would just give you an example of how to define that particular problem. So in this case, we write, in rural hospitals, patients experience an average wait time of 3 hours due to unstaffing and inefficient triage. So in this problem statement, instead of just saying patients wait too long in hospital, there is a queue in hospital, we are saying that in rural hospitals, where we are defining that there is a particular context where is this particular problem existing, it is existing in rural hospitals. Then we are talking about patients experiencing an average wait time of 3 hours. So we are defining the average wait time, where we are calculating how much time is wasted of each patient due to understaffing, and inefficient triage. What, like, inefficient triage could be people are giving VIP treatments. There could be a person who is a friend of the doctor, and they are treating them. They are sitting in the cabin for like 1 hour. That could be one of the problem statements. Then understaffing. There might be just two people, like maintaining the hospital records and everything. So this is how you define a particular problem, which gives you a solution. So while you're thinking, I'm so sorry, while you're thinking of a solution, so in this case, if we are thinking of a solution to be proposed in rural hospitals or for the government hospitals, we think of, and we like, while we are talking about problem definition, we also have to think of the solution at all times. I'm not saying that we jump to conclusions or jump to solutions, but if we identify problems, we are always seeking for a solution for that particular problem. We are not just complaining about a particular problem and understanding the problem from an idea where we want to complain more about an issue, but we also want to propose a solution to it. That's why we are thinking about design thinking. We are taking this workshop. We want to build something that is more empathetic, that is more solution oriented. So while we are talking about this, it becomes really important for us to understand the problem so that we propose the best solution possible for that particular problem. So here, if we want to propose, say, I'm just giving you an example. If we want to propose a solution for this particular statement, that in rural hospital, patients experience an average wait time of 3 hours due to understaffing and inefficient triage. Our problems become understaffing and inefficient triage. Understaffing, suppose it's a constraint that I cannot, from here, if even if I build something digitally, I may not be able to suffice the understaffing because I'm not at authority to do so. But while we are talking about inefficient triage, maybe there could be a system that is developed for the hospital. It could be maintained by one person who is equipped to digitally equipped, who is well versed with technology. So we can build a system that maintains record for each patient. Suppose I am maintaining records for the regularly occurring patients or people who visit me weekly, visit the hospital weekly. Then I register their profiles on the system, and m- like one doctor, if one doctor is taking care of it, we could take appointments, and if there is no slot for today, we could keep some slots for emergency, like 10 slots for emergency, and then we could keep the regular visitors and maintain, like, give them the appointments accordingly, so that everything is organized. So this could be one solution to this particular problem. If there are more problems attached to the same problem, the solution could be altered, the solution could be modified, there could be more features added to that particular solution. Any questions up till here?
Ma'am, we have
Should I?
we have query session at the end of session. So you may
Okay.
continue,
Okay.
please.
All right. Thank you. So again, like one of the techniques to transform problem into opportunity, like we are always talking, I just spoke about the solution part of it. So while we are defining these problems, there is a technique called how might we, which is basically understanding the problem in a way which provides you a solution. So how might we questions, like it's a formula. How might we, then we put do what, for whom, in order to like b- give the benefit. So for example, while we are, if we talk about diabetic patients struggle with medication adherence, so how might, if we want to turn it into a how might we example, how might we help diabetic patients track their medication intake more effectively? So this becomes an opportunity for anybody or any doctor to understand or help their patients to take their medications more effectively. And that, like, obviously doctors would want to help their patients more. So this is how you turn any problem statement into a more opportunity seeking, or bridging the gap between the solution and the problem. So this is a very important tool when it comes to understanding what can we do in order to solve the particular problem that we are facing or anybody is facing. So when we are talking about healthcare solutions or healthcare innovations, there could be multiple different problems that are yet to be seen. So especially when it comes to rural healthcare system in India, there are not many technologies that have reached the rural grounds, or not many technologies that have reached even the tier 2 cities of India. So while we are talking about those problems, the solution for those problems will only come from understanding first the problem, and secondly, framing those problems into such a way that we have opportunities around those problems, and we can propose that problem to a particular fraternity, maybe the government, maybe the private sectors, maybe the insurance companies, to understand and like propose a better system for good healthcare in India. The opportunity mapping could again like begin with identifying the pain points, understanding the impact and feasibility of a particular solution that you are going to propose, and match those opportunity areas with like the newest innovation. For example, if we want to incorporate AI into healthcare system, lot of if you must have heard, there are a lot of mm, AI diagnostics that are happening, not 100% accurate, but a lot of diagnostics are happening, and AI has been used to identify health heart problems or heart rates on a very regular basis, especially in US, like these days. So these could be the opportunity areas. And given the innovation, like tech innovation, what is happening today in the world, given the impact and feasibility, what a particular business can afford and do, and what is doable in a particular area, and given the pain points, we could do a value proposition canvas. So while we are talking about these problems, here if you write how might we, which are your solution, like all the problems that you have from your user research, if you have multiple different problems listed, and you map everything down in one circle, which you can call how might we. It could be solution, it could be pain points, all of these problems could be put into this one particular circle. Then if you talk about the solution, like how you want to propose it, what are the actual needs from these particular problems, what could be the wants would be something that is like I would want also, like instead of just me taking care of my regular sugar levels, I would also want somebody to let me know when to take a particular medicine, like an assistant maybe. What are my fears for that particular solution? I might not trust the technology that much. So these are particular things that you would want to map out before proposing a solution, before building a solution. So when you do this, it is a great tool to identify the exact opportunity that we have. So it will always be a very small gap from the problem statement and something that we would want to give. Like a lot of ideas come when we are thinking about, okay, I would want to also do this. I would also want to generate more, you know, like more when you're brainstorming ideas for solutions, there are more ideas which are very innovative, which are not so feasible. And when you're talking about problems, it could be more ground level problems. So identifying and funneling that and mapping that to one particular thing which is feasible, which is doable, which is usable for the users also, and which is very much beneficial at that particular time is what you call opportunity mapping in this particular case. So now I do have an activity for you all. I would be sharing a link in the chat. Just uh, somebody has a question. I think they're raising their hand. Can you guys let me know if you're able to open this particular slide?
Green Maria, you can ask question. Maybe.
Is it by mistake?
Maybe it is by mistake.
Are you guys able to access the PPT that I shared? I see two people here. Okay, I see yes. I will share my screen again. Okay, so this is the activity which I would ideally want everybody to uh, do. So let's consider a problem in and honestly, I would want everyone to have a particular problem statement if you guys have it. So here I am giving you an example. In public hospitals, patients wait for an average of 3 to 4 hours for consultation, which we have been discussing. So the pain points could be frustration, delayed treatment, and even overcrowding. And here, if you define this particular problems, patients in urban or rural hospitals, I could like change it, or you can change it according to your understanding. Hospitals experience an average wait time of 4 hours due to inefficient triage and resource constraints. Next is, this is a resource slide. So we will consider a persona of Dorothy. And is everybody with me? I'm not able to understand. I'm really sorry about it. Okay. So Dorothy is based out of Dublin, and she is mostly introvert. She is generally more empathetic and more sensitive, like she's feeling more and talking less about it. She's a very loyal person. So this is the persona of Dorothy. So I would give you like 5 or 2 minutes maybe to understand who this person is. She's an old age woman. She's in her 60s, in her old age. She's retired. She was a nurse before she retired. She retired as a nurse. She has grandchildren. The major problem that she has is she has diabetes, and she has to visit the doctor regularly, either monthly once or maybe bi-weekly. So this is her problem, like a pain point. The challenges she generally faces in life are more when it comes to like she has to drive a lot and she's living alone. She doesn't understand technology as much as us, and she doesn't like to ask for help. She would want to do everything on her own. This is a major challenge that she generally faces. Her goal in life is to maintain her sense of freedom. She also wants to enjoy her retirement after so long. So, like, there are two things that we would be doing here. Actually, three things, but the third is more for you to inspect and introspect. The first technique is empathy mapping. So, for Dorothy, if you want to do the empathy mapping is basically a tool where you empathize so much with any user or any user persona that you would want to understand them on a deeper level. So, to understand anybody or to a deeper level, you need to understand what they are saying, what they're thinking, and what they're actually feeling about it versus what they're doing for it. Is there any question, Rima?
No,
So
ma'am.
this, okay, sure. These are general, this is a general tool which is used for user empathy mapping. And considering Dorothy as one of the personas, we would want to understand, empathize more towards her. Green Maria, you have a question? And somebody else also raised their hand. I cannot see your name. Any questions? Uh, okay, then are you guys able to edit these slides? Yes, no, anything? I see a lot of people here. Are you guys able to edit the slide? So I would request you to take any text box here and put let's do this activity of empathy mapping. So you can take your we can take 2 to 5 minutes to do this activity where we are understanding this persona, and based on this particular persona, whatever you see here, you would want to put what she says, what she thinks versus what she feels and does. Is everybody ready for this? I would request people to like take any text box instead of writing here. Take a text box, and I would, for an example, I would say that Dorothy says that she's independent. You can also say it, and I would be very happy to write for you. Anybody wants to share their thoughts on what Dorothy generally says? Anyone? I see almost 150 people here.
Ma'am, Gautam has written, she is strong.
She's strong. Okay.
And she is confident also.
She is strong and she's confident. Okay.
She is powerful, ma'am.
What else?
She is hardworking, madam.
She's hardworking because she's going to the grocery stores.
She's conscious about her health also.
She's conscious about her health. Yes.
Feel good to do own things.
I think that is that falls under independence.
Yes.
Yes. Health conscious. And anything else that she says that she is.
Of late, she is like into some kind of aging issues that doesn't permit her to perform her task on her own.
Do you think that she says all of this or she thinks this?
Yeah, it is there actually. It says actually like but lately it's been difficult for me to get around.
Okay.
The reasons may be many, but yeah.
Yeah, definitely. I'm just, this is a very engaging activity. I would like to brainstorm with you guys on this. So you're saying that she's saying she's not, she's facing health issues. Age issues. What else?
She says she loves her granddaughter and she wants to spend time with them. Grandchildren, in fact.
What she says and what she thinks, that will be overlapping, almost same.
Might be. So that might be a case with a person who is, so if you go to her persona again, she's to, like, if we talk about her personality says that she is more introvert than an extrovert person. So when you're talking about thinking and saying our same thing, there are times that you think more than you say. Like, for especially for an introvert person, she might be saying that she would want to uh, spend more time with her grandchildren, but she might be thinking that she would want them to come to her house instead of she going to their house. That could be, I am totally making it all up, but that could be one of the cases.
Yeah, I think she's having some difficulty in understanding the complex new technology trends.
Is it something that she is feeling, or is it something you think she's saying?
It looks like it is kept under challenges, actually. Under challenges, it is mentioned.
So she's
Okay.
feeling now, because she's saying it's a challenge. So she's feeling that she might find difficulty in understanding the new time trends.
Are you feeling or experiencing in reality?
Yeah, but she's not saying it out loud. So here we would put things that she's saying out loud. Oh God. One sec.
It's one of the item under challenges, ma'am.
Yeah, it is. I'm saying that it would be, so a challenge could be a feeling also.
It will come under feeling, madam. That one.
What was the exact point? She's facing technology, like facing issues, understanding new age technology.
Yes.
So what would we say that she's doing and thinking? Is she doing her own task, going to the grocery stores, going to the hospital?
She is enjoying her retirement.
Okay, that she's doing.
Doing own things. She's regularly visiting to the hospital. She's cleaning the house.
She's cleaning the house. Yes. So this was my another question. One second. Cleaning the house.
Yeah, it says driving to hospital for regular visits means
Yeah.
definitely she might be having some health issues.
Yes.
Diabetic. Yeah, it clearly says diabetic patient and needs to visit the doctor at least once a month or bi-weekly.
Driving to hospital.
And now she is no more an independent person, but she needs support from family to go out.
That is what she's feeling.
Where it is written?
This is all in the persona, ma'am.
No, ma'am, it's written she is very independent. Sir is saying that she is now feeling dependent. She is very independent is written, no?
Can you point out, Mr. Chandra, where you, what exactly was your point?
Under background, ma'am. Actually, see, maybe once upon a time she is independent, but over a period of time, because of health issues like diabetic and no other issues, she has to travel frequently to the hospital. That means she is facing some health issues, critical issues. And under challenges, it's clearly mentioned that getting around town has gotten difficult without asking for help from family.
But this is still she's feeling. She's independent. She generally, if you think about the background, she's doing all these tasks. She's just facing these issues. So when you're talking about challenges, getting around the town has become difficult. Then this is something that I'm feeling, and I'm writing under my challenges as Dorothy. I would write my challenges that now it has become difficult. Like I do go to the hospital visits, but now it has become difficult for me to do so.
And in the course, she is also written that she is facing difficulty to get around now.
Yes. But her goal is to maintain her sense of freedom. So she would want to maintain her sense of freedom. She would want to do all these tasks that she is doing, all of it.
Yeah, she needs support,
She would want,
but now she
yes.
needs support.
Is that something that she thinks that she needs support? More support?
Yeah, in the code it is mentioned, ma'am, she loves getting out of the house and doing things on her own. But lately it's been difficult for her to get around. That clearly states actually currently she is.
Yeah, that is my point.
But we have written that she faces age issues. What else do you want me to write here? Let me know. Sorry.
In the thing, she needs support. Yeah, you have already written.
Is that what she thinks, or is that what she's actively saying? Can you guys identify that?
Okay. Actively saying. It has been difficult for me to get around. I'm actively saying, I think.
Actively saying that she. Okay. So do you think she thinks that she's independent and she's not actively saying that she's independent?
Previously, she is independent, but because of the issues or something, medical problems, now she thinks that it is difficult for me to get around like that.
Okay. So is like, does anyone see any problem in this map so far? Or is it correct? It's absolutely okay that she's not thinking and like saying everything. That depends on the persona or person to person. While we are also defining these personas from the user research, it would always, like, there would be cases where people are not saying much and thinking more. So there could be, say, taking an example of if somebody who is facing more health issues, or somebody who is, if there is a persona of a person who is going through depression, maybe. So somebody has deleted all the slides. Okay. So while you're talking about, say, depression as a problem, then we'll always say that they're they are not saying anything, but thinking and feeling would be more heavy on this particular map. Does that make sense? Should I move on to the other slides?
Yes, ma'am.
Great.
Yes, ma'am.
Okay, but now I would not have like the other pieces. I would just copy. Thank you. I would repaste the whole slide. The other tool to understand the problem and the opportunities better is a journey mapping tool. So once you define the persona, once you understand and empathize with the persona in any form possible, or like when you are defining also the persona, the user research is done in multiple formats. You either research through interviews. So you, if when we are talking about patients, you either interview those patients one on one, or you do a survey in a particular county to understand what the users feel. Users here are like patients, what the users feels and feel and think. Or it might be a very like a field study of a particular hospital, when you go observe the patients, observe the doctors, how they're behaving, what they're doing. So all of these challenges could be put into different kind of personas, and once you understand all these personas, then like you would want to understand how they navigate through their problems. So when you're talking about journey mapping, this could be like this could be an as is scenario. So you write a problem statement. Suppose when you're considering this particular problem or this particular problem, this could become your uh, journey mapping ka statement. So a patient could be Dorothy. So Dorothy visits. So this could be, while we are defining this scenario, I could always write, and I welcome more suggestions. So I would write Dorothy visits the hospital, her nearest hospital, for a regular checkup. While she would want to discuss her new occurred pain in left hand. Do you think this is a good problem statement to discuss? Anybody has any suggestions for Dorothy? Anyone? Okay. So while we are talking about journey mapping, if we consider this particular scenario, when we talk about journey mapping, is we would want to break this particular scenario into multiple different phases. So first phase could be, I would want to, or anybody wants to take an attempt. Okay, I would just go through it. Visiting the hospital. That could be the first challenge that she faces. Then your second phase would be waiting in line. Third challenge could be visiting her doctor. And final thing would be discussing. Do you think this makes sense? So these could be the phases that we would want to discuss in a journey map. While we are defining these journey maps to understand and empathize more with any persona, we would want to understand in each stage what they're doing, what they're thinking, and what they're feeling. So this, while we do this, from this could be from empathy mapping, this could be from the persona, this could be something that you in your brain while you're thinking or making a story for Dorothy, you would want to understand or go through their journey. Like you would want to go to the hospital, what are you doing? You may be driving a car, you're taking a cab. So if you're Dorothy, what would you do? What would you feel? So while you're visiting the hospital, what are you thinking? Maybe this problem could be really concerning to me. Maybe this is a small issue, maybe this is a big issue. So all of these things, when you are mapping them all together here, that becomes your journey map. So I would want to, if this is suppose the phase, does anybody want to take an attempt on understanding if Dorothy is doing this, what would she be doing while she's visiting the hospital? Do we want to say that she's driving or taking a cab? If there are any chat messages, I'm not able to see.
Driving, ma'am.
Driving?
Yes.
Uh, do you think anything that she's thinking while driving? If she's going to the hospital?
Yeah. About the time required to get her problem solved because of the waiting period and a new issue what she is come up with pain in the left hand.
Okay.
Might be she might be thinking of what all symptoms she has to discuss with the doctor regarding this particular pain, or she has to discuss about the reasons why she's feeling all this thing she might be thinking of.
New pain. She's concerned about the new pain.
Right.
Anything else?
We might be thinking about the money, ma'am.
Okay. The doctor's fees or the new
Hospital fees, ma'am. Hospital fees.
okay, the hospital fees. What else do you think that she might be thinking about? Could she be thinking about more house related stuff or things that concern her, that if she would go through any procedure due to this new issue, do you think that she would be concerned about that?
Yes, ma'am.
Yes, maybe.
Maybe. The diagnostics and if needed.
So worried about the future? Can I write that?
Yes. Yes.
What do you think she's feeling at that time? Like here we would want to write more emotions. Do you think, can you think of any emotion that she might be feeling?
She is more worried
Yes,
because
she
of a
might be
new
feeling
problem.
anxious, no?
Anxious.
Yes.
And
Ma'am, Dr. Sangeeta has written, how will do housework?
how she will do. So she's worried about the future and also household work. Are we okay? So if we think, I think we are done with visiting the hospital phase. Now she's maybe waiting in the line. What do you think she's doing? Obviously, one is waiting. What else do you think she's doing at that time?
Ma'am, she might be conversant with those who in queue.
Are also in the queue, yes. Conversing with fellow patients only. Do you think she might be asking continuously to the receptionist how much time it will take?
Yes.
Okay. What else do you think? What do you think she must have asked when she reached the hospital?
Is doctor available, or what will be the my number?
Exactly. Now, when we are talking about these things, what do you think is like is she's thinking while she's taking these, like waiting in the line?
How long the wait will be? She might be thinking about that.
Okay. What's the wait time? But she has already asked this, but I agree she would also think about it.
Thinking.
Yes.
What will doctor say?
Yes.
What else? So again, when we are talking about what she's thinking, so here also she's feeling worried and anxious.
Yes.
Yes.
Does the emotion change by any chance? Or
No, not possible, ma'am. She has not met with the doctor yet.
okay, she has not met,
Still,
but
still
she's already
anxious.
at the hospital. Do you think
Yes.
she's a little relieved?
Yeah, little bit. But until and unless it is diagnosed what she is having, that anxiousness will always be there.
Okay. Anything else? Do we write any new feeling or any added on stressed feeling that we would want to write in while she's waiting in the line?
One more relaxing point is there. She is at the hospital for any case of an emergency or something happens. The people are there to look after her.
So she is a little bit relaxed, little bit.
Yes.
Okay. Little relieved, I would say, or relaxed. Anything else we would want to add here? So while she is visiting the doctor now, it's her turn. She's there. What do you think she's doing? Or what could
She's
she?
talking to the doctor, ma'am.
Stating her problems to the doctor?
Yes.
And
receiving advice or prescription from the doctor.
Receiving advice. What else?
Asking doctors many questions regarding what might be the problem, what she is facing.
Do you think she okay? That could be also the case because she must have talked to a lot of patients around her, and they must
Yes.
have told her, okay, this could be, this might be related to this might be related to this. So hence she's asking multiple questions. Do you think she's also concerned about any new tests that she's going to undergo and
Yes.
asking questions related to that?
Yes, that's
Yes, ma'am.
Diagnostic related question. This would all be, do you think she would undergo any lab test there and then?
Yeah.
Okay. Getting a test done.
Ma'am, Dr. Savita is writing reason of new pain precautions for future. Ask about the reasons of new pain precautions for future.
Okay. I think I'll definitely write it, but these when we are talking about getting a test done in the story, we are all like we are talking about the new pain only. I will write it. 1 second. Asking. Do you think, can you think of anything that she's significantly thinking about apart from these problems? Like these things that she already had these questions. Do you think she's thinking about anything else while she's getting the test done or visiting the doctor? Let me just add.
What may be the results of the test and what can be diagnosed?
Yes.
Thinking about follow-ups or any other lifestyle changes.
Brilliant. Lifestyle changes. And you mentioned what could be the result of the
lab tests?
Anything else? There's nothing new that she's thinking apart from all these questions. But do you think there is a change in how she's feeling?
Yes,
When
ma'am. She will be more relaxed, but
More
still anxious about the results of tests.
and do you think she's while she, like after the queue when she met the doctor, there was sense of happiness that
Yes.
she's now able to see the doctor? She's happy.
Yes, ma'am. That relieves a lot of anxiousness. She told everything what she was feeling about her problem and all with the doctor now.
So she's relaxed. And is there anything that I would want to, like you would want to add to her feelings?
She feels positive. Might be.
Positive, yes. Happy, positive. Do you think she's optimist like that? I don't want to get into, but
Hmm.
so considering that the test results are good and she is not facing any issue. That this is we call in UX or any, like, while we are building a story, we call this a happy path. So taking the happy path and we say that she's not going through any problem. This is just a minor muscular issue. What do you think she's doing while she's returning back home from the
Driving back home.
driving back home? What else?
Taking some household things while back home.
Okay, grocery shopping. Do you think she's calling anybody to let them know that she's fine?
Yes, family members.
Calling the family members?
Yes.
Informing family members. Anything else that she's doing or she would do or she should do?
She take the medicines for herself, whatever the doctor prescribed.
Continue with her daily activities because now she's feeling relaxed.
Okay, so feeling relaxed.
Relaxed, happy.
Okay, so is she also relieved about the fact that there are no lifestyle changes?
Yes. Except for the one what she is having, diabetes and all, which is persistent.
Definitely. That is one ongoing lifestyle.
Yes.
What is she thinking? What can we say that she's thinking?
Thinking about the next, what she can do, because the problem what she was facing is relieved now. What next in the life and how much time she can spend with the family members and grandchildren.
Thinking about precautions she have to take.
Yes. Anything else? Okay, so basic understanding of, does everyone understand how do we empathize with the user? And there are multiple tools to get into the depth of a problem, understanding who the problem is for. How can we understand the problem and the people who are facing the problem more? So whatever we did so far is basically to understand the user who are facing these issues. We are understanding the problems via going through their footsteps. So what they are facing, the journey map tool helps us to face the particular problem in that, like get into that zone, get into that footstep of what if we were in that position. So now that we know Dorothy so much, now that we know the user so much, if we were going through the same thing, what are the particular pain points, what are the particular touch points that we are going through, and how now the next point is how do we solve these particular issues. So if you think about where the users are feeling anxious, where the users are having that pain point, what is the touch point where they are facing that particular touch point. Now while you're designing a particular solution for it, while you're thinking of a particular solution for it, what how this helps is this will let you know at each touch point. Suppose if I build an app for Dorothy, which on one, maybe like on one touch or two clicks, lets her book an appointment, give her a particular time, that what time she should visit the hospital so that she doesn't have to wait in the line. So this gives me all the touch points for Dorothy to understand where she's facing the particular issue, what is the exact issue that she's facing. So this is the basic importance of understanding the problem and what exact, like how the problem definition matters so much. So once you define a problem in the most absolute form possible, that is when you are able to give the best solution for that particular issue or a problem. I think this is all I had for problem definition and opportunity mapping for this session. I hope this helps you guys in understanding and reiterating any problem that we face in our life and also in like while we are solving a problem for a bigger user base. Any questions, anyone?
Dear all, please turn on your cameras for a few seconds. Thank you.
Thank you, Daksha ma'am, for this wonderful session. If anyone wants to ask any question regarding the session, can directly ask to the expert by unmuting your mic. After that, we will go further.
Abida, please conclude the session.
Okay, ma'am. Thank you, ma'am. Your discussion of problem definition and opportunity framing was particularly insightful, and I'm sure we all have much to think about. We appreciate you taking the time to be with us. Today's session has been incredibly valuable, providing us with a fresh perspective on how to approach challenges and unlock hidden opportunities. Ma'am's insights on the framework for identifying root causes was particularly impactful. A huge thank you to ma'am for sharing your expertise and passion with us. We hope you leave here today feeling empowered to tackle challenges with a new sense of clarity and purpose. And with that, we come to the close of what has been a truly insightful and thought provoking presentation. From clarifying the crucial first steps in any project to highlighting the potential for innovation hidden within challenges, your insights have been invaluable. For sharing your time and knowledge with us today, thank you so much, ma'am.
Thank you so much for having me. I am open to any questions if anybody has.
Thank you, Daksha. We will meet tomorrow again.
Yes, and I hope it was helpful for people to understand problems.
Thank you, ma'am.
Thank you.
So now it's time to wrap up the session. As we conclude today's sessions, I hope we all are leaving with a renewed perspective on how we approach challenges and identify opportunities. We have not only discussed the how.
Has one question, I think.
Okay, ma'am. Okay.
Yes, ma'am. No one has any question.
Yeah, Yojana raised her hand. I thought she has a question.
I think it was by mistaken.
Okay.
One of the most valuable aspects of events like this is the opportunity to connect with peers, share ideas, and build lasting relationships. I hope you all have had a chance to do just that. The conversations we heard have been really, truly inspiring, and I'm confident that these connections will continue to flourish long after we leave here today. Thank you to all the participants also for being here. We look forward to seeing these innovative solutions you develop in your life. We shall meet again tomorrow, so kindly request everyone to be on time. Until then, take care and have a great time. Thank you so much.
Thank you all. We have shared form link for feedback, session 4. Kindly fill that. Thank you all.
Thank you.